Now, for years, we've been measuring mass amounts of lipid with the idea that these molecules are pretty much sparingly soluble in plasma. And if levels get high enough, they can come out of solution and get deposited in the intimal areas of the heart and, of course, set us up for cardiovascular disease. And so what we've done, I think, traditionally is we've measured the mass of the total cholesterol, the triglyceride, total triglyceride, and then later on we found out that fractionating the kinds of cholesterol that we have floating around in blood was quite useful, especially when we found out we had HDL cholesterol is actually a good lipid, rather unusual, having a high level of a lipid being a good thing. And then, of course, LDL cholesterol has turned out to be the real culprit in the story, propagating the disease in most cases. So we know that measuring that is obviously important. Now, many times we don't actually measure it, though, in the lab. We use an estimation called the Friedewald formula to actually calculate the LDL. And then there's been some interest developed in the amount of cholesterol that goes around in the VLDL particle, especially in the metabolic syndrome patients. And so it's not the total cholesterol story in terms of mass, but it's the kind of cholesterol that has generated a lot of interest. Now we're finding out that the disease is multifactorial to a greater extent, finding out that it's not only deposition of lipid telling the story, but we're finding out that, of course, we've got these markers where we can look at inflammation, because the deposited lipid sets us up for inflammation. And the inflammation propagates the disease and thickens the arterial wall and sets us up with these thrombogenic factors leaking out of the fibrous cap and causing a thrombus. So we go from a chronic disease that took decades to develop over to a rapidly acute disease that can kill the patient, depending on the vessel that the blockage is taking place in. And of course, we know too that coronary heart disease involves nutritional factors as well. And we know, of course, using niacin and some other nutritional treatments are helpful in some patients. So we're thinking that the story obviously is mass, and that's a traditional measurement, but also measuring inflammatory markers like high sensitivity CRP and like the PLAC A2 test, certainly another inflammatory marker when we measure the activity as opposed to measuring the mass. So I find this is a very exciting development where we're getting a better handle at the molecular basis of the disease. And it's no surprise, really, that it relates as a risk factor when we do all these multi-institutional studies.